Welcome back to our program. We are honored to have with us in the studio Dr. Maryam Al-Kandiri, a PhD pharmacist, to shed the light more on the field of clinical pharmacy. Welcome to our program, Dr.
It's my big pleasure to be with you in this lovely talk program on KTV2.
You're welcome. Okay, so let's get to the basics first. First of all, can you explain to our viewers what's the meaning of clinical pharmacy?
Before I start to talking about the clinical pharmacist, I'd like to explain what the clinical pharmacy is. Clinical pharmacy is the area of pharmacy that concerned with the science and the practice of the rational medication use. Rational medication use is mean that when the patient receives their medication, it should be appropriate to their clinical needs. In doses meet their requirements, daily dose, as a part and as on a period of time with low cost for them and for their community.
Absolutely. So what are the qualifications that a clinical pharmacist should obtain?
First of all, we can talk what the clinical pharmacists. Clinical pharmacists, we are the pharmacists who are interested to deal and like to work in direct way with the patient care and their healthcare provider in collaborative manner. And this is like it's be done by like a pharmacist process, a consistent process which has a multiple steps, such as like the data collection of the patient care, assessment of that data, and also like a development and implementations of like management plan.
Absolutely. So what you're saying is that a clinical pharmacist will be in action in the wards between the patients and having like a face-to-face contact sometimes with the patient.
For sure, like in an inpatient's ward, they have like explanations for that patient, especially the patient with the chronic diseases such as like asthma and also like hypertension, people, diabetes type 2. Really, they have to be explain about their medication and how, if they have like multiple and polypharmacy medications, so how they will work together and how they can reach to the optimal medication use.
Absolutely. So let's say within the medical team, which is involved multidisciplinary, multi-specialist within the hospital, what are the tasks are entitled or expected from the clinical pharmacist?
There is a great collaboration between like the pharmacists and the physicians. So they have to be they playing an important role with these collaborations in getting the safe for that patients and improve their quality of life. Moreover, we can say that they have to be like reduce the medication error if they have this collaboration. And they will be also like they will have a solution and solving of the medication related morbidity and mortality.
Absolutely. So if we go a little bit more in details, for example, a patient with high blood sugar, for example, is a diabetic patient who's in the ward. Okay. Usually, the clinical pharmacist should be involved in the line of the treatment of this patient, I'm assuming, working with internal medicine, endocrine, possibly surgery. How would you fit, I mean, in between all these specialties?
For sure that the clinical pharmacy will involve with these chronic diseases such as the hypertension or type 2 diabetes. They will like talking to that patient in like in details about their medications, about the side effect, the adverse effect, and how they can have the effectiveness and believes in that treatment. Also, this is in a physical part, but there is also a psychological support for that patient, especially when they have like a patient-centered care, which they will hear, and they will make sure that they hear the voice of that patient via like they will be involved that patient in their their plan, their management plan, and also about knowing about what the doctor and also the pharmacist's management plan.
Absolutely. Now that's for the inpatient. What about the outpatient?
Outpatient, especially for follow-up, if the patient they needs like a review on their medications or like a further assessments about their treatments, the clinical pharmacist will play a big role in that area, so that they will have like explain more about the dose and the adverse effect and side effect of that medications.
Absolutely. All right, so we're going to take a short break. Don't go anywhere. We'll be right back. Welcome back to our program. We have here in the studio with us Dr. Maryam Al-Kandiria, PhD clinical pharmacist. Dr. we were talking before the break about the qualification that needs to be possessed by a clinical pharmacist, because this is a new field, I would assume. So can you explain, can you elaborate more for our viewers, what are the qualifications necessary to be obtained by a clinical pharmacist?
After 5 years graduate in the degree of pharmacy, if the pharmacist they are interested to have like an advanced treatment, additional training, they can also have like a 1-year postgrad in like clinical care, drug information. They have to also having the teaching methods. Also they have, if they need like to do some research for 12 months, it's a year. Also, we have like the pharmacists who interested more than that, the postgraduate 1 year, they can completions of the 2nd year, which also have like a critical clinical care for that patients. Also, they have like infections for the infections diseases, internal medications diseases. So they can also have their additional research. So in totally like a 7 years to complete for a clinical pharmacist.
And again, it depends on the interest of that in the clinical pharmacist, who would be specialized, for example, in infectious diseases, as you said, maybe pediatrics.
Yeah.
All right. Yeah. Now, as far as the clinical services that can a clinical pharmacist provide in the hospital, what are they?
First of all, we can say that the specialized pharmacists, they should be focused on the optimal medication use, and also they should have like the identifications for the adverse effect the side effects, and also like they should focus on the efficacy of the medication to reach the optimal medication use.
Absolutely. So you don't necessarily prescribe the medication for the patient, but you actually can kind of get involved in the decision making, I'm assuming?
Yeah, because as we say that there is a collaborations between the physicians and also the clinical pharmacists, especially the pharmacist, they can do a recommendation for some doses of the medication, especially in the for example, the pediatrics wards. They can like give their recommendation according to the age and the weight of that child, if the doctor need really the recommendation from the pharmacist.
So would you say that the high level of collaboration between the clinical pharmacist and the other specialties, whether it's surgery, pediatrics, or internal medicine, for example, can have a positive outcome on the patient?
For sure, it has a positive to improve their quality of life, and at the same time to reduce the medication error, and also to improve and promote the health life for that patients.
Exactly, and also to make sure that the quality of the service, the health services provided for the patients, whether inpatient or outpatient, will be optimum.
For sure.
Absolutely.
Yeah.
Now, in order to achieve all that, I'm assuming there should be some level of cooperation between the clinical pharmacist, which is fairly kind of new field now in the health sector, with the other specialties. How important that level of cooperation?
I think it will be on two sides, on both sides, the physical and psychological support. Especially the psychological support, really it's play a good role in improving the impact and the impact on their quality of life, and also we have to reduce any lack in the relationship between the patient and the healthcare provider. Also, we can focus on the treatment beliefs of that patient, so that it will be like encourage the patient to have the effectiveness of the medication and the healthcare at the same time.
Well, that was very interesting information you shared with us, Doctora. We thank you so much for being with us, and we hope that we will see you again soon in our program.
Thank you very much.
Well, our viewers, we will watch the next report, but before we move to the next segment, so please stay with us.